After living donor surgery, the average length of the hospital stay for a living donor is 1 to 2 days. Prior to discharge, prescriptions will be written and filled to allow you to take pain medications and stool softeners home. Constipation is a common problem after the living donation surgical procedure and the use of narcotics for pain control. Adequate fluid intake, walking, and the intake of high-fiber foods is advisable. You will be trained in how to care for your wound prior to discharge. Living donors need to return to the clinic for a surgical follow-up appointment 2 weeks after discharge. You should not lift anything weighing more than 10 pounds for at least 6 weeks. With the exception of walking, you should avoid physical exercise, exertion, and contact sports for approximately 6 weeks after your surgery. As a donor, you will need to take time off work, between 4 and 8 weeks depending upon the type of work you do. You may resume driving 3 weeks after surgery and when you are no longer using narcotic pain medications. Although it varies by individual, the total recovery time for living donors is between 4 and 8 weeks. Barring any complications, after the 2-week postoperative clinic visit, donors may return to the care of their primary care provider. After the initial recovery period, donors may resume their normal physical and life activities. You will want to maintain a healthy lifestyle. Everyone should drink plenty of fluids each day, a minimum of 2 liters. You should avoid using over-the-counter, nonsteroidal anti-inflammatory drugs, or NSAIDs, such as Aleve, Motrin, ibuprofen, and Advil. You should avoid using prescribed anti-inflammatory drugs such as Indocin, Naproxen, or Naproxen. You should see your primary care physician for a general health maintenance exam every year. The exam should include a blood pressure check and testing for kidney function and blood sugar levels. If you maintain a healthy lifestyle, your living donation will not increase your risk of developing health problems in the future, such as kidney disease, diabetes, or high blood pressure. Pregnancy following organ donation is not a problem after the initial recovery period. Female organ donors are able to become pregnant. It is recommended that you advise your physician that you have been an organ donor. It is unlawful for anyone to provide financial or other incentives to organ donors. While as organ donors, you are not responsible to pay for the medical care you receive in the evaluation, donation, or follow-up care. There are other non-medical expenses that you will incur. The National Living Donor Assistance Program is a federal program that, in some cases, can provide assistance with expenses related to donation. Please ask our staff and they can assist you in applying for this program. As a donor, you should not pay for the healthcare services you receive. If you do get a bill for these services, please contact us so we can assist you. Please refer to the Living Donor section of your patient education guide for further explanation. There are resources available to help you as you consider and/or proceed with living donation. Our Donor Mentor Program provides a forum for previous donors to speak with you and share their experiences. Ask your transplant coordinator if you are interested in this program. There are several websites available that may be helpful to you: ustransplant.org and nationalkidneyfoundation.org.